So, Bismillahirrahmanirrahim. Assalamualaikum, salam sejahtera. Good afternoon. My name is Nazura, and today my group and I will be presenting about Angelman syndrome. Our group consists of 6 people, which is me, Nazura, Wanushura, Aisha Perkins, Nur Naziha, Abraham Soidi, and Mimi Shamira. So when we were first assigned to do this SCL about human genetic disorder, and when we were given the freedom to choose any topic that we want, my group and I decided to pick this topic because we were like, why not choose a topic that not everyone is familiar of? And so here we are today. So about this syndrome, the background history started by Dr. Harry Angelman, an English physician at Warrington General Hospital. It started when he was observing children who had a bright demeanor yet similar symptoms of severe intellectual delay, lack of speech, seizures, and also motor disorders. So back then, he published a paper at 1965 about the syndrome and these children, and he called these children of his patients as puppet children. Fun fact, these children are called puppet children because Dr. Harry Inselman was inspired by a Renaissance painting about a boy with a puppet. And the face of the boy, the facade of the boy, has a similar smiling demeanor as his patients. Fast forward 25 years later, researchers and scientists decided that this disease was quite common among children. And so they named this syndrome after Dr. Angelman, and the Angelman Syndrome Foundation was established to support the research and also the society of people who are affected by the syndrome. Next is symptoms by Naziha.
Okay, next we move on to the symptoms. So children with Angelman syndrome can be distinguished since early during infancy, which is approximately during 6 to 12 months. So first, let's go to the first symptom, which is being restlessly or can be called as hyperactive. And secondly is frequent laughter that may occur at inappropriate times. So inappropriate times means that it doesn't occur at all the time. It is in a condition where it doesn't supposed to be in laughter, but it doesn't sound normal. And that is the side-to-side curvature of the spine, which is called as scoliosis. Then a white mouse with widely spaced teeth, which one of the physical criteria that can be distinguished as the disorder of this Angelman syndrome. Next is the hand flapping or walking with arms in the air. Next, particular fascination with water. Children with Angelman syndrome is very fascinated with water. They get very excited with water. Next, skin, hair, and eyes is paler than other family members, but it doesn't look different from other family. It's just certain criteria such as skin, hair, and eyes. Then cross eyes, which is strabismus and tendency to stick the tongue out, and also short attention span, which also can give other complications that is going to be discussed later.
So I will be talking about the causes of Angelman syndrome. So the Angelman syndrome is caused by the deficiency of E3 ubiquitin protein ligase, or also known as the UBE3A gene expression in chromosome number 15, or to be exact, the 15q11 until q13. So the abnormalities will cause the absence, changes instructions or functions or even expression of the genes. So how does the disruptions of UBE3A occurs? We have 4, which is the first one, chromosome deletions, where micro deletions occurs on the region mentioned above, 15q11 until q13. So when this region is being deleted, we will not be getting any UBE3A gene expression because the gene sits there. Okay. The second one is imprinting error. Imprinting error means that the patients have a defect in genetic imprinting caused by the errors in DNA methylations. The third one is paternal uniparental disomy. Disomy is a situation where a person receives both copies of chromosomes from only one parent instead of two. In Angelman syndrome case or situations, the patient will inherit both chromosome 15 from the father. That's why it is named as paternal. So the effect is the maternal derived chromosome will not be expressed. Last but not least, it is UBE3A mutation. When the UBE3A is mutated, which means the UBE3A genes with lost its functions, and doctor can use the loss of the functions as the sign of a person having Angelman syndrome. The next topic is inheritance.
So before that, the mode of inheritance in this family is autosomal dominant modified by imprinting. What does it mean by autosomal dominant inheritance? This means that one copy of a mutated or changed gene from one parent is enough to cause the genetic condition or disorder instead of recessive, which need two copy to show its mutation. While imprinting means that a gene is being expressed only in the chromosome inherited from one or the other parents. So, first of all, in most cases, Angelman syndromes are not inherited, particularly those are caused by deletion in the maternal chromosome 15 or by paternal uniparental disomy, which have been mentioned by Abraham. These genetic changes usually occur as a random events during the formation of the reproductive cell, which is eggs and sperms, also in early embryonic development. However, rarely the genetic change which are responsible for Angelman syndromes can also be inherited. For example, a mutation in the UBE3A gene or in a nearby region of the DNA that control the gene could be activated to be passed from by the parents to another generation and to another generation, which is they will be inherited, which also have been mentioned by Abraham. So next, I will pass to Wanushura.
Okay, so next is about the Angelman syndrome incidence rate, which is a person with Angelman syndrome will affect males and females in equal number, and the prevalence of Angelman syndrome is estimated to be approximately 1 in 12,000 to 20,000 people in the general population. However, many cases may go undiagnosed, making it difficult to determine the disorder's prevalence in the general population. And a person with Angelman syndrome will have a near normal life expectancy, but for sure, they will need support throughout their life. Okay, so we can proceed to the next.
Next is complication. So from the symptoms, there are some complications that can be got from these Angelman syndromes. So first, infants and children with Angelman syndrome can be, as I have said, it can be distinguished through behavioral pattern that is marked by a happy demeanor and frequent and also inappropriate laughter and smiling. These children with Angelman syndrome can be easily excited, hypermotoric, and also hyperactive, which is this hyperactivity will tend to decrease as the children get older. But they are active explorers that often appear to be constantly in motion. Secondly, children with Angelman syndrome may have sleep difficulties such as problems as such as frequent waking. Okay, these frequent waking are frequent findings for the children with Angelman syndromes. Next, lastly, which is the feeding difficulties. Feeding problems may occur during infancy, often as a result, which is poor sucking ability. So the infants with Angelman syndrome can have like swallowing difficulties, and these feeding problems associated with Angelman syndrome is not severe, but it also some of the complications that can be faced by the children with Angelman syndromes.
Okay, now that we have understand more about Angelman syndrome, is there any cure, treatment for us to treat this Angelman syndrome? Okay, unfortunately, there's no cure. There's no specific therapy or treatment to cure this syndrome because this syndrome is not something that is common. As mentioned, as lecturer mentioned earlier, it's only occur in one out of 20,000 people. So it is not common. Therefore, it receives less attention from specialists in medical field. Okay, not so much research has been done for this. But at the moment, there is a research that is focusing on targeting specific genes that Abraham mentioned earlier, the ubiquinone one, specific genes for treatment. So there's actually an ongoing research. Okay, however, at the moment, even though we don't have any specific treatment, but if people with Angelman syndrome went to the doctor, the doctor and specialist will advise them to just minimize the symptoms that the Angelman syndrome patients has been facing. For example, the first one, they will provide anti-seizure medication to control the seizures. Okay, and then the second one, they will have physical therapy to help with walking and movement problems. Okay, and then the third one, they have communication therapy. Okay, this communication therapy include sign language and picture communication. And then the last one, they have behavior therapy to help overcome the hyperactivity and the short attention span and to aid in their development, because as mentioned from my teammates earlier, they have slow cognitive disability. So and their behavior is more hyperactive than the other kids. Okay, and this symptoms, this treatment can be applied to all ages because the Angelman syndrome can occur in any age. Doesn't apply to kids only. So that is pretty much the medication, the cure that is available for now.
That's all from us. Thank you.